little bit late, per usual. By that I mean like a minute. So yeah, running. Let's go. Okay, it's a video, so you can talk. First station 3.
I don't want you looking back over here. What I want you to do is put some pressure. I told you to flick around because the dots are on the other side. And what we're going to do is we're going to put some pressure.
What you'll be seeing is her carotid, which is here. Here's her jugular. You should give them your phone and have them take you while you do it.
Can't see it.
Get all your gel all over your patient. Make sure it's nice and lubricated so you slide your probe around. You're going to find your vessel on the screen. So there it is. Let's decrease our depth. See the line on the transducer right there? So we're going to put that there. And we're just going to, I'm going to kind of take a steep angle. Vessel center. Find your center line with your needle. Come in at a little bit more of a steep angle because you're going deep for jugular. Insert the needle straight until you see the tip on the screen.
Time for day 2. Hey guys, okay, so I know that the video ended kind of weird. The second day of the ultrasound course was pretty much the same thing, so I didn't really end up recording a lot of it just because it would just been a repetition of like day 1. And it was overall, I would say that the ultrasound course was absolutely fantastic. So the way that it was structured is that we had a series of lectures to get through initially, and then once we got through those lectures, we had a few months to do them. They were very long. After we got through those lectures, we had a 2-day session where we had standardized models and patients come in, and we got to practice our skills. So it was fantastic. We had these amazing instructors and they taught us a lot. So I would highly, highly, highly recommend that going into practice, I feel more confident having done the course, because I feel like if I had an ultrasound at my disposal, which you don't always do, but if you did, then there's a very quick and easy way to get the answers that you need to provide the care that you want to give to your patients in a very efficient manner. Yeah, I really enjoyed it. Hope you guys enjoyed that. All right.